This is the big week, and the president, he's been called the closer by Speaker Paul Ryan. He's going to be able to put that to the test this morning, coming in to meet behind closed doors with the House Republican Conference. And the reality is this: they need his help to try and close the deal. They started to do some of the work on their own, releasing a manager's amendment, basically a package of changes to the underlying health care bill in the hope of trying to draw both some of the moderates, some of these Tuesday group members that you hear about, and some of the conservatives who are wary about that underlying text. The big question now, though, becomes, will those changes and will this big final push from President Trump be enough to close the deal? Bottom line, they need 216 votes. They're still planning on having the final vote in the House on this bill on Thursday. They're short right now. If you talk to aides, they're very honest. They know that there's work to do, but they believe with the changes as they're incorporated, with the president's help behind closed doors, as I said, the closer, if you will, that they can get this across the finish line. One of the really key issues to keep an eye on, guys, as this moves forward, obviously, besides what the president himself has to say behind closed doors, is on those changes and what will happen next. You're starting to hear a lot of reliance on what the Senate will do to make this package more palatable. Is that enough to sell these skeptical House members? We'll see in just a couple days' time. Christine and Dave?
Yeah, the clock is ticking, Phil Mattingly. So let's talk about what these changes are that Republican leaders are making to get the bill through the House. They include giving states the option of taking their Medicaid money as one big block grant instead of per enrollee, as the bill says now. States could also require able-bodied Medicaid recipients to work, something conservatives want. And states would be barred from expanding their Medicaid rolls now, ahead of the planned phase-out of the Obamacare Medicaid expansion in 2020. The Obamacare taxes would be repealed this year instead of next, and $75 billion would be set aside to increase the health insurance tax credits for those consumers in their 50s and early 60s that AARP says they will hold lawmakers accountable if they raise costs for those older consumers.